I'm Staff Sergeant Stephen Still from the Defence Medical Academy. In this lesson we're going to discuss moving and handling a patient. By the end of this lesson you'll be able to explain body alignment and positioning, explain complications of incorrect positioning, explain basic patient positions, demonstrate patient positioning, describe legislation and guidelines for moving and handling, describe typical injuries in handling, explain safe patient transfer guidelines, and demonstrate through practice equipment used when assisting a patient to transfer. So Management and Health and Safety at Work Regulations 1999, the Manual Handling of Operations Regulations 1992, and JSP 375 Volume 2, the MOD Health and Safety Handbook 3rd edition 1995 are all legislative and documentary guidelines for moving and handling. Manual Handling of Operations Regulation 92 defines manual handling as any transporting or supporting of a load, including the lifting, putting down, pushing, pulling, carrying or moving thereof by hand or bodily force. So duties of the employer. The Health and Safety Regulations imposes a duty on every employer to ensure as far as reasonably practical the health, safety and welfare at work of all employees. This means the provision and maintenance of work systems that are safe and without health risks. The provision of information, instruction and training for all employees. Duty of the employee. Avoid moving and handling if a patient can move themselves. Assess, does the move need to happen? Assess the risks and assess the equipment used. Reduce. Reduce the risk by using equipment if it's available. You must carry out a risk assessment before any move. You're to assess the task, what have you been asked to do, the individual, are they able to move themselves, the load, how much you're being asked to move, the equipment, have you got any equipment to assist moving, and the environment. Are you moving from one ward to another, or is it simply a bed-to-bed transfer? Further duties of the employee, you are to take reasonable care of your own health and safety and those who may be affected by your decisions, acts and omissions. You are to cooperate with your employer to enable them to comply with their health and safety duties. Body alignment, this helps the patient to feel more comfortable, it relieves strain, it helps the body function more efficiently, prevents complications like contractures and pressure ulcers. Incorrect body positions can create pressure ulcers, which are bed sores, and contractures. Basic body positions: prone, supine, lateral, and Fowler's. We have some pictures here. Prone, as we know it, is on your front, supine on your back, left lateral and right lateral laying on your sides, and Fowler's, which is essentially sitting up supported. Some typical common carers injuries: musculoskeletal injuries, damage to skin, so cuts, bruising. Common patient injuries, again musculoskeletal, cuts and bruises, and damage to fragile skin. Bear in mind these patients are ill, they're in hospital for a reason, their immune system is going to be compromised and the skin may start to break down. So any movement that you're doing with these patients is likely to injure them further. Good movement achieves its objective efficiently with minimum effort and maintains a natural elasticity of the body. Some do's of patient movement: know the method of transfer, know the patient's capabilities, use correct body mechanics so they move normally in a normal fashion, place the bed in the lowest position before starting a standing transfer. Hospital beds have the ability to lower and raise. Lock the wheels on the bed, wheelchair stretcher before the move. Elevate the head of the bed prior to transfer. Use a transfer belt for standing transfers unless contraindicated through injury. Some more do's: make sure the patient is wearing shoes. Be aware of tubes or other items. Again, these patients are going to be unwell. They're going to have IV cannulas going into their arms. They could have oxygen tubes around their mouths and the back of their heads. Be aware you don't pull anything out. Transfer the patient toward the strongest side if possible. Some patients you might be dealing with may have had strokes. They might be weak on one side. Make sure you support that side more than the other. Explain what you are doing and how the patient can help. Test the patient's understanding and make sure they know exactly what you expect of them during the transfer. Stand close to the patient during the transfer, but encourage the patient to be as independent as possible. Poor movement leads to low back pain and other musculoskeletal disorders. Some don'ts: never allow patients to place their hands on your body during a transfer. Never place your hands under a patient's arms or shoulders. Never have the patient use a footstool. Some common equipment might include a pat slide, which is the whiteboard here, which will allow you to do a bed-to-bed transfer. You just slide them across. Transfer belts, which can be pictured here, which is a waist belt which goes around the waist and around the hips and the thighs. Swivel disc, this one here. Manual handling slings, or hoist, or Sara steady. Some facts for you. So 80,000 healthcare professionals hurt their back every year. 3,600 healthcare professionals retire as a result of back injury every year. 6,000 serious injuries from moving and handling reported to the HSE every year. So in summary, you can now explain body alignment and positioning, explain complications of incorrect positioning, explain basic patient positions, demonstrate patient positioning, describe legislation and guidelines for moving and handling, describe typical injuries in handling, explain safe patient transfer guidelines, and demonstrate through practice equipment used when assisting a patient to move. Here are some references for further reading.